Tardive dyskinesia is a side effect that can occur from taking antipsychotic medications, which are used to treat mental health disorders like schizophrenia. It causes stiff and jerky movements in your face and body that you can't control, such as blinking your eyes, sticking out your tongue, or waving your arms unintentionally. Not everyone who takes antipsychotic drugs will experience tardive dyskinesia, but if it does happen, it can sometimes be permanent. If you notice any movements that you can't control, it's important to let your doctor know right away. They may lower the dose of the medication, add another medication to counteract the movements, or switch you to a different drug to help ease your symptoms. Tardive dyskinesia is a condition that causes uncontrollable and jerky movements. This can include movements in your face, like sticking out your tongue, blinking your eyes fast, or puffing out your cheeks. It can also affect your arms, legs, fingers, and toes, causing you to wiggle your fingers, tap your feet, or sway from side to side. These movements can be fast or slow and may make it difficult for you to work and stay active. Antipsychotic medications, also known as neuroleptic drugs, are used to treat conditions like schizophrenia and bipolar disorder by blocking a brain chemical called dopamine. This chemical helps cells communicate and keeps muscle movements smooth. If you have too little dopamine, your movements can become jerky and out of control. Tardive dyskinesia, TD, can develop after taking antipsychotic drugs for 3 months or more, but there have been rare cases of it occurring after just 1 dose. Older versions of these drugs are more likely to cause TD than newer ones, although some studies find a similar risk from both types. Common antipsychotic medications that can cause TD include haloperidol, Haldol, fluphenazine, risperidone, Risperdal, and olanzapine, Zyprexa. Taking antipsychotic medication for a longer period of time increases the risk of developing TD. In addition to antipsychotic drugs, some medications used to treat nausea, reflux, and other stomach problems can also cause TD if taken for more than 3 months. These include metoclopramide, Reglan, and prochlorperazine, Compazine. Certain factors can also increase the likelihood of developing TD, such as being a woman who has gone through menopause, being over the age of 55, alcohol or drug abuse, and being African American or Asian American. Tardive dyskinesia can be difficult to diagnose. Symptoms may not show up until months or years after starting antipsychotic medication, or even after stopping the medication altogether, making it hard to determine the cause of the symptoms. If you are taking medication for mental health conditions, your doctor should check you at least once a year to make sure you don't have TD. They can perform a physical exam called the Abnormal Involuntary Movement Scale to help them assess any abnormal movements. Your doctor may also conduct tests to rule out other conditions that can cause abnormal movements, such as cerebral palsy, Huntington's disease, Parkinson's disease, stroke, or Tourette syndrome. These tests may include blood tests and imaging scans of the brain, like a CT or MRI scan. So, how do we prevent TD? If your doctor prescribes a new medication for a mental health disorder, be sure to ask about the potential side effects. It's important to weigh the benefits of the drug against the risks. If you start experiencing movement problems, don't stop taking the medication on your own. Instead, talk to your doctor about it. They may be able to take you off the medicine that's causing the movements or lower the dose. In some cases, you might need to switch to a newer antipsychotic drug that's less likely to cause TD. There are 2 FDA-approved medications to treat tardive dyskinesia, deutetrabenazine, Austedo, and valbenazine, Ingrezza. Both of these medicines work to regulate the amount of dopamine flow in the brain areas that control certain types of movements. It's important to note that both medications can sometimes cause drowsiness. Additionally, Austedo has been shown to sometimes cause depression when used in patients with Huntington's disease. While there's no proof that natural remedies can treat TD, some may help with movements. These include ginkgo biloba, melatonin, vitamin B6, and vitamin E. But be sure to talk to your doctor before taking any supplements for your symptoms.